All right, good morning, everyone. Welcome to this week's Regional Report, a GPEC Virtual Series, a very special report today. This is our Greater Phoenix Tech Challenge. We're going to have a real exciting one-hour webinar coming up for you. My name is Eric Sperling. I am the Managing Director here at the Social Television Network. If you're not familiar with STN, we are a local media company based here in Phoenix. We have a streaming network that you can download from the App Store. All of our shows and segments are dedicated to community leaders, actionable solutions, community growth, hence our relationship with GPEC and their president and CEO, Chris Camacho. He has made several appearances on our network, some great segments there, and very excited to partner with GPEC on this virtual series, especially today. Really looking forward to some great content we're about to deliver your way. Very exciting. Also want to mention, for those of you just logging on, our next regional report will be next Wednesday, June 3rd from 1 to 2, and that will be on the hospitality and tourism industries. So look for that invite coming. And if this is your first time joining us, we do have some housekeeping, as always, that we like to go over. Today's webinar will last for approximately 1 hour. Audience members are muted and without video. This webinar is being recorded and will be shared on the GPEC website and social media. You may submit questions for finalists using that Q&A feature at the bottom of your screen, but again, due to time constraints, we may not be able to get to all those questions. Should you experience any technical difficulties at all, I'm sure you've experienced this, just log off, log back on, and that usually fixes it. And we do invite you to share this information on social media. Please feel free to tag GPEC and use the hashtag GreaterPHX together where appropriate. And again, a special part of today's webinar, there will be polling. So today's webcast will be interactive. After each finalist has presented, we will launch an anonymous polling feature to gather your impressions. And after all 4 companies have presented, the audience will also be able to vote on their favorite finalist company. The polling results will be shared with the judges to use as a factor in their deliberations. So let me introduce the judges. The Greater Phoenix Tech Challenge will be judged by Jimmy Choi, Associate Vice President, Entrepreneurship and Innovation at Arizona State University. Jimmy has over 20 years of experience in higher education as it relates to entrepreneurial and public-private partnerships, including working at Tisch School of the Arts at NYU and at the Earth Institute at Columbia. She also served in a leadership role for the United Nations Development Program for numerous startup organizations and companies. Also joining us, you see him on screen, Brandon Clarke, co-founder and CEO, StartupAZ Foundation. Brandon is the co-founder and CEO of that foundation, a nonprofit that helps Arizona's most innovative startups improve their leadership performance and connections while inspiring generosity and philanthropy within their communities. And finally, we have Fred Pakis, Pakis Center for Business Philanthropy, Arizona Community Foundation. Fred co-founded JDA Software in 1985 and served as president, co-CEO, and co-chairman of the board for various periods of time through 2000. JDA Software is Arizona's largest software company with over 4,000 employees and revenues in excess of $700 million. The company is headquartered in Scottsdale, Arizona, and operates in over 70 locations around the globe. He currently serves as chairman of the Pakis Family Foundation, which recently celebrated its 20th anniversary. And I do want to apologize. I just blew through one of the slides there. I want to acknowledge our I6 Challenge partners here. Arizona State University, the Center for Entrepreneurial Innovation, Partnership for Economic Innovation, StartupAZ Foundation, Arizona Community Foundation, again, Pakis Center for Business Philanthropy, who is funding this Greater Phoenix Tech Challenge, and of course, GPEC, the Greater Phoenix Economic Council. These organizations, they've been working together to develop regional innovation strategies through the U.S. Economic Development Administration's I6 Challenge, and have all been integral partners in the development of WearTech, that's an Arizona-based applied research center dedicated to advancing wearable technology innovation. Okay, so we've gone through our partners, we've gone through the judges. The 4 finalist companies presenting today are Televeda, represented by co-founder Shruti Gurudanti, Sensagrate, represented by founder and president Daryl Keaton, Navi Nurses, represented by CEO Jasmine Bhatti, and Beacon Biomedical, represented by CEO Donald Weber. Okay, so let's get to our finalist companies. First up, we have Televeda. And so I am now going to kick it over to Shruti for her presentation. Shruti, take it away.
Hello, everybody. My name is Shruti Gurudanti, and I want to start by thanking GPEC for this opportunity and everybody who's here listening to us So senior living communities or senior housing, an umbrella term that I'm going to use, and that includes assisted living, independent living, nursing homes, the whole gamut of senior housing. Now, the number one problem, next slide, please. The number one problem in senior housing is their staffing issues. The staff is extremely overburdened, they're underpaid, and a direct consequence of that is that the activities and programming in these communities really suffer. About 25% of the residents in any senior living community are isolated and lonely. Now, did you know that isolation is as bad for your health as is smoking 15 cigarettes a day? This is according to an AARP study. It actually increases the risk of mortality by 50%. This is a humanitarian crisis for our elderly, but it's also very, very bad for these businesses because they see a problem in retention, and it leads to a revenue loss in these businesses for up to $3.5 million. This is in the best of times. Now, post-COVID, the staff, which is already overburdened, has to wear multiple hats. And now their core focus is keeping these residents safe and alive. So all of the programs and activities have been canceled in these communities. There's no rec center, no dining. Residents are asked to stay isolated in their rooms, so much so that we have a community that has guards outside their floors, making sure that they're not leaving their rooms. So social isolation, if it was a problem before, is way worse due to the lockdown and the quarantine right now. Next slide, please. This is how our families are aging in these communities today. And it's only because they need to be safe and they need to stay alive longer. Next slide, please. So virtual programming was being considered by communities before, and they were looking at virtual programming for operational efficiencies to bring programs to seniors so that social isolation can be less. But now with COVID and the forced isolation of seniors, virtual communities have gone from becoming a novelty into a necessity. They have become what used to be probably a vitamin now into an aspirin. But even the best of us are trying to figure out how to run online programming. It is not as simple as sending a Zoom link. And I'm sure the organizers of this event know that there is a lot that goes into setting up and running virtual programs. It takes a good deal of effort. It's one of the most stressful jobs. And this staff is already overburdened, right? So now they have to figure out, all right, how do I become an overnight YouTube celebrity? How do I figure out what platform? How do I maintain security? Oh, now how do I help Judy, who is, by the way, 80 years old, figure out how to download Zoom? So imagine doing an online program for a room full of 80-year-old grandmas. Next slide, please. That's where Televeda comes in. We help organizations that service the seniors and vulnerable by providing them with an end-to-end class management software for virtual programming. Next slide, please. And how it works is that our software provides organizations with an online infrastructure that helps them build, grow, and scale virtual communities. So we do everything from providing them with online content to providing them with an accessible platform that seniors can use and participate in, to providing them with an automated system of reminders, and most importantly, tech support. We take care of all of the tech support so that the residents can stay active and engaged and understand how technology is used. The communities now, instead of worrying about how to figure all of this out on their own, have a simple plug and play option, and they can get their virtual community up and going. And now seniors don't have to feel isolated anymore. They can communicate with their families and their neighbors from the comfort of their rooms. Next slide, please. So in the last 2 years, we've worked very hard to build partnerships on our media component to work with really players who are preeminent in the live streaming space. So we've worked with the Cleveland Museum of Art, and with, we have a program on extreme weather. And so we worked very hard to figure out who are the top players in live streaming. Next slide, please. And has COVID really impacted us? Absolutely. We have had to change a lot. We were a group system before where groups of residents would participate in our classes. But overnight, we've had to scale tremendously into having 20, 30, 40 users, seniors participate in our classes. We've changed our onboarding and we've changed our onboarding process to individuals. So has it impacted? Yes, we have, but we've scaled our product significantly for individual users. Next slide, please. And the best part is that that is visible in our growth. We've doubled our revenue in the last 30 days. We have over 1,500 users. We have 10 times X our number of minutes. We've had probably like 9 out of 10 customers who've converted from pilot to long-term. Next slide, please. We focus a lot on our communities in Arizona and trying to scale into new verticals. Now, not just seniors, we're helping also individuals with disabilities, the whole entire city of Chandler with kids from the age of 3 all the way to seniors. Next slide, please. I think I'm going to go to our last slide because it seems like I'm running out of time here. But our ask from the community is that this is a humanitarian crisis. And seniors are hit the hardest when it comes to COVID and COVID-19 and social isolation. This is an opportunity for us to serve not just seniors, but any other vulnerable population that is dealing with isolation. And we can really help eliminate that problem by using technology. We are Televeda, and I would love to take some questions now.
Shruti, thank you so much. We do have a few moments. I'm going to ask the judges now to just turn on their video and unmute their microphones. If there are any questions, we will have Q&A at the end of this, but we have a few moments before the next presentation for any of the judges if you'd like to ask Shruti some questions. It's live, it happens.
Shruti, I got a quick question. Well done, first of all. Does your service require anything in person? So do you need to send staff into these facilities to help with setup? And if so, how are you overcoming that with obvious concerns with, keeping these communities safe and isolated?
Great question. And no, we do not have to send anybody into the communities. We're very respectful of the no-touch policy that has been implemented in these communities. And so everything that we do in terms of tech support, we have a 24/7 tech support, and our tech support works with the staff as well as the residents. Everything is done remotely with them. And we spend hours sometimes trying to help them figure out from the smallest thing, like where is the Safari icon? I can't find it. From the smallest thing like that all the way to how to figure out, where you have to click and what has to happen. And we do all of that remotely.
Shruti, Fred, first off, this is a subject very near and dear to my heart. I have a 91-year-old mom who we actually sprung from her nursing home right before the lockdown back in March. And we have her at home, and we do our Saturday bingo games with my family via Zoom, and I understand intimately the technical challenges of getting this kind of stuff up. My question's a serious one, though. The grant of $50,000 looks like it's been designated for a tech support infrastructure. Can you speak to that platform? Who you're using? How do you envision that working?
Yeah, great question. So I 100% understand, first of all, from personally what you mean by having to, have your mother now figuring out technology, which is beautiful in and itself, right? Because now she's figuring out how to adapt. The grant money that we would use is because with COVID, our model, our operations playbook has had to change significantly. And so one of the things that we've seen that is being used a lot on our side is our tech support. We get a lot of phone calls from a lot of our users just on small items to figure out, like I said, where is the icon? How do I use the internet? The video is not working, the audio is not working. At any point in time, we want to make sure that if we get a call, someone is picking that up. Right now, we're getting overwhelmed by phone calls and we don't have enough warm bodies to pick up the call. And the last thing I want my customers or my users to experience, or beneficiaries like we call them, is to have to stay on the phone for longer than 5 minutes. 5 minutes is also really pushing it. I don't want them to be on the phone for more than a minute. And right now, we're not honestly being able to service that. A minimum wait time is 5 minutes for us. And I want to cut that down significantly, for which I need the $50,000 so I can have our own inbuilt system where there's a round robin system where, you know, if someone doesn't pick up, someone else is picking up, or it goes to a system and then we have a callback. So I just need a more robust system so we're servicing our beneficiaries in the best way possible.
Do you have
Shruti,
a package in mind, or is this internally developed? Are you envisioning?
So so since you asked me, this is probably going into the weeds, but we had built our own internal system. But since we're getting overwhelmed by our tech support questions, we had to shelf that and then go into another sort of system, outsource our call support. But it is expensive, and we want to bring that back and build it in-house, for which we need the funding. We need a dev team, actually. I need to have a, in order to scale, not just, you know, our tech support, but also our platform, so that we can have these 1,500 users that we're seeing already. I need a dev team in order to scale that. And I think that $50,000 would go a very long way for us to scale our dev team and to get that tech support in place.
Okay, Shruti and Fred, Brandon, thank you guys so much. And Jimmy, we're going to bring you in after our next presentation for sure, but we do want to launch the poll. Again, you're invited to participate here. Shruti will ask you to turn off your video and mute. And as Bethany launches the poll here, we've got about 30 to 45 seconds. Again, this will be a portion of what the judges will discuss during their deliberations. But we have a few more moments here to go through the poll, and then we will move on to Sensagrate here. Again, judges, thank you so much for your time today. Great questions there for Shruti. And Jimmy, we'll definitely bring you in here as we move on to our next presentation. Okay, I do want to introduce, we have Daryl Keaton joining us. He is the founder of Sensagrate. So Daryl, I will let you take it away now for your presentation.
Thank you. First, thank you GPEC and the ACF for this opportunity. Hello, my name is Daryl Keaton, president and founder of Sensagrate. At Sensagrate, we've always been focused on saving lives with our first product, SensaVision, which is a real-time software for intelligent traffic safety solutions. When COVID-19 hit, we realized our technology and experiences had the opportunity to make an impact during this crisis globally to help reopen businesses and save lives. So we recently launched Sensacat, a multi-symptom detection system. Next. The problem we are solving are for businesses that are challenged with developing plans to protect employees and do not have efficient technology solutions to manage and prevent a COVID-19 outbreak for reopening their business. Next. Sensacat is a sensor-based integrated technology solution that automatically screens employee temperatures and detects also for sneezing, coughing, heart rate, and respiratory rate at the point of entry with the highest accuracy, providing real-time pass and fail alerts and data analytics to management to identify risk of COVID-19 and other respiratory illness outbreaks. Next. Sensacat has a cloud-based software as a service solution that provides real-time alerts via email and soon text message to management for temperature screenings above the threshold. The application provides daily temperature readings and data analytics and reporting with machine learning and AI to assist with identifying hot zones within your business with corrective action plans for alerted screenings. And we do not collect any personal identifiable information. We have a three-phase approach, starting with temperature, in phase 2, developing heart rate and respiratory rate, and in phase 3 for cough and sneeze detection. The application is being built to be used for any brand thermal temperature scanning solution to help position to scale the SaaS application. In addition, we're also using our existing product, SensaVision, to monitor and detect for social distancing within businesses. Next. We are targeting the US manufacturing industry where there is over 600,000 businesses, and we've identified a total addressable market opportunity of $5.6 trillion. Next. Our go-to-market plan is that we've established technology, position ourselves in a supply chain for the demand of these solutions as a reseller for 2 manufacturers. And one of our pilots is at Avnet, where they are testing our technology solution because it's more accurate than other sensors they have in place. Also, Avnet has an IoT partner program where we are working with them to integrate into their platform and place our solution in their IoT marketplace, launching in June. The advantage this brings to us is Avnet is a leading global IT manufacturer in 70 countries and have customers inquiring about the type of product we have brought to market. We also have other partnerships and interested parties to provide Sensacat to airports, airlines, and in the healthcare industry, including senior living communities. These relationships put us in the position to scale not only in the US, but globally. We are enhancing our sales and marketing effort to include building a sales team, launching an e-commerce site, and advertising online and on social media platforms. Next. In our revenue model, initially we're starting with transaction fees and selling the sensors with the SaaS application, then evolving to a reoccurring revenue model as a time fee and plan for hardware and SaaS subscription model for 1 to 2 years. A percentage of our profits will be donated to communities in need to provide individuals with protective gear, hand sanitizer, and PPE to healthcare systems. Next. Our competitive analysis is that Sensacat provides critical analytic information to companies about temperature variances, alerts, and social distancing violations in one overall solution as we grow and we are establishing other symptom detections at entry points that can also be installed throughout a business. Next. The use of funds of the $50,000 grant will be used to purchase hardware for the sensors to start establishing inventory, purchasing marketing such as online campaigns to increase sales, update our website for e-commerce, and maturing our CRM system. And then cover legal fees for the SaaS application, use of technology and service level agreements, and pay for employee salaries. Next. So why Sensagrate? We have the experience, expertise, network, relationships, and mentality to execute in whatever we put our mind to, and we move very fast. We have an amazing team of industry experts and PhDs and have a vast technical experience in business development, sales, marketing, and artificial intelligence. Our experiences include myself helping businesses scale from 1 to 10 million in revenue to 10 million plus, and also Big Four consulting. Mark has over 20 years in software development, including Intel's IoT and Chandler. Kuyong's a machine learning specialist with a PhD from Johns Hopkins. Greg is a software engineer and has spent time at a local successful startup, Bravo Tip and Pay. And Matt, who built the application, has technical experience in everything from cybersecurity, cloud management, and the healthcare industry, and Big Four experience. Next. At Sensagrate, we're on a mission to save lives. Our vision is to use our technology to prevent the spread of COVID-19, help businesses, the economy, and our communities open safely, and improve public health data for testing and resources. Next. Thank you for your time. My name is Daryl Keaton, President and founder of Sensagrate.
All right, Daryl, thank you so much for that. Let's bring our judges back in. And Jimmy, I'll start with you since we didn't get to hear from you last round. Do you have any questions for Daryl?
I do. First of all, Daryl, thanks so much for your presentations and congratulations on your pivot. Quick question, do you have a medical partner or anybody that's going to be able to help with the remediation part? One part of this is about sensing and detecting. Is there another part about what to do about it, what to do about once there's been some detection at a particular site? So any
Sure.
medical partners that you're talking to?
Sure. So Matt is a cybersecurity expert and from the healthcare industry, and he's helping us manage the relationships and compliance that we need to have. And then one of our vendors is also being finalized for FDA clearance. And then we're also working with a potential capital partner in the future that has healthcare industry experience and will help us grow into that market too.
Brandon?
Daryl, Fred, so you're pivoting from driverless cars, right?
We provided infrastructure solutions for connected and autonomous vehicles using computer vision technology.
Perfect. Well, yeah, congratulations. So my question is, the $50,000 grant, as you described, is nearly half hardware. What phase does this correspond to with your features in terms of temperature, cough detection, respiratory? Where are you in your phases as a result of this first tranche?
Sure. So right now we're vetting and validating more through the temperature scanning and selling those and getting that out in volume. So starting in June, we'll be doing the respiratory and heart rate. So we've identified and done research on the algorithms we need to pull into place. And then in July, we'll be doing the auditory for sneeze and cough detection.
And before we throw the poll up, Brandon, do you have any questions for Daryl?
Just a quick one, Daryl, if you could clarify, you're not developing the hardware. You've got resellers in place. You're the software provider powering these systems. Is that right?
Correct.
And the integration of all those various sensors and systems, yes? Because that's
Exactly.
really what the software play is.
Exactly. So we take all that data elements and help it make sense through data visualizations and reporting to the end users of our customers, which they're all looking for, because most sensor companies are only providing the hardware, but they're not getting data to help manage their multiple locations. So for Avnet, they have over 100 locations. Their chief logistic officer can't get any insight and doesn't have eyes or ears on what's happening on the ground, and it's all done manually. So they need the data to help them empower that decision-making sooner than later when a potential outbreak could be happening.
All right, judges, thank you so much for your questions. And Daryl, I'm going to ask you now to turn off your video and mute your microphone. Bethany is going to launch the poll. Again, we have about 45 seconds here for you to take part in this poll. And again, you're seeing the judges engage in some great Q&A. As an audience member, you have the opportunity to submit those questions as well using the Q&A feature at the bottom of your screen. And hopefully we can get to some of those questions before our time is over today. Just a few more minutes on the poll here before we move over to Navi nurses. All right, I want to transition now. I want to bring in CEO Jasmine Bhatti. She's the CEO of Navi Nurses, and I believe she is joined also by Ayan Saeed. And so let us go over to Jasmine now for her presentation. Jasmine.
Good morning, Brandon. Thank you so much. I'm Jasmine.
And I'm Ayan. We're registered nurses and co-founders of Navi Nurses.
The purpose of our company is to save lives and to create a new and exciting category of healthcare. Recently, a woman in her mid-50s presented to the emergency room with a week-long worst headache of her life, but she had waited, unfortunately, a week too long. She had a brain bleed and it was too late to save her. This is a true story, and sadly, she's not alone. People are dying because they're afraid to go to the emergency room. In fact, emergency room visits are down 50% nationwide, and people are waiting too long to be seen for life-threatening conditions simply out of fear of going to COVID hotspots. These unintended consequences are what we consider COVID collateral damage. Next slide. Next slide, please. Thank you. So today I'm so thrilled to present to you Navi. We are the Uber of nurses. We connect sick people with expert nurses virtually or in person for support, advocacy, and guidance with decision making. However, in response to COVID, we have developed two new categories of operations. The first, Navi will now become the go-to telehealth platform for patients to immediately connect with a nurse practitioner who can diagnose, prescribe, or direct them to an emergency room. And second, we're ramping up to provide in-home vaccinations by registered nurses, first for their annual flu shots, and then for COVID-19 when it becomes available. Next slide. Thank you. So when patients feel sick, they log on to Navi Nurses. Our algorithm then matches them with a perfect nurse practitioner or registered nurse, depending on their specific needs. Payment is made securely through a portal. Next slide.
Navi connects patients and their families on demand with a brand of trusted nurses who represent excellence. Our nurses will treat you like family, providing individualized care when and where is best for you. This leads to primary health care that's more safe, more convenient, and translates to more lives being saved. Next slide. Nationally, there are 175 million admission and ED visits per year. Our initial target market is Arizona, which alone has 2.5 million yearly admissions and visits. And yet, 157 million Americans suffer from chronic diseases. These are the people who are afraid to go to the hospital and are waiting too long to be seen. They represent the new wave of people who will be sicker with even more health problems. Next slide. There will be a $75 average fee per visit with an initial profit margin of 18%. We can confidently capture 5% of the Arizona market which is 125,000 people. If each of those patients utilized 8 hours of our services per year, our profit will be 15 million. We project a $5 per acquisition cost per patient, as we're hyper-targeting at-risk older populations for patients, and we have a paid organic channel growth strategy for nurses. We have big ideas to convert patients into subscription users, as well as adding an in-home vaccination program, which will lower the cost of patient acquisition, leading to an increase in our profit margin as we scale. Next slide. Our team is power-packed. We're passionate industry experts. We have 45 years of expertise among the 3 co-founders. We have extensive experience in bedside nursing care, administration, regulation, and accreditation. Our advisory board members are also nationally recognized in their fields. Next slide. We'll be using the majority of funds for patient acquisition and a smaller amount towards purchasing PPE to keep patients and staff safe during home visits. Next slide. So we're so excited to provide safe and effective care to our patients and to help bolster the Arizona startup community and also lead a dynamic nursing care change nationally. My co-founders and I want to thank you, the Greater Phoenix Economic Council, and the judges, attendees, all of our friends and family for this tremendous opportunity to be here with you today. Throughout our entire careers, all 3 of us have saved lives, so many, one by one. But today, we invite you to help us save more lives using technology and all at once. We're now happy to answer any questions that you may have. Thank you.
Jasmine and Ion, thank you so much. Judges, Jimmy, Brandon, Fred, let's bring you into the panel now and offer up any questions.
Sure, I have a quick question. Jasmine, Ion, thank you so much for your presentation and your work as nurses. Really life-saving work that you're doing, so appreciate that. Quick question, it looks like this is private nursing on demand with payments being made by the individual patients. Are you contemplating any insurance reimbursements or any co-payments or Medicare coverage or anything else like that, or is it really the private nursing market?
Thank you, Jimmy, for that question. You know, originally we'd started as private pay, and that was really for registered nurses to come out and provide supplemental advocacy, support, and helping our elders age in place safely. But now, by adding in the nurse practitioners, we have the ability to really tap into the insurance industry. And our partner that we will be using for our telehealth has the ability to connect us with the insurance providers themselves, so we can cover all of these things without actually having a copay.
Brandon, Fred, any questions?
Yes, yeah, follow on to Jimmy's question. I mean, is this fundamentally a telehealth platform, or I noticed you mentioned home visits and using the Uber analogy. Which is it primarily?
You know, the Uber for nurses is really what we are, and having the telehealth platform is simply a component of it. So what we do is match the best nurse with the exact needs of the patient and what they're looking for. And from there, they're able to, if they need a nurse practitioner or someone who can diagnose and prescribe, that will then allow them the opportunity to use the telehealth platform.
Before we launch the poll, Brandon, did you have a question?
Yeah, a quick one. I'll echo what Jimmy said. Grateful for both of you. My wife's a critical care nurse, so this hits home. They struggle with communicating the options for patients that utilize the ER versus urgent care versus any other services. How do you broadcast this as an option widely enough to where you can actually make an impact in that space? Because they often see patients, as I'm sure you guys do as well, that don't need to be in the ER and they just need guidance more than anything. So how do you message that?
You know, I think, Brandon, that's exactly why we're here today, is because we need the money for marketing to help share the fact that, yes, we're nurses. This is exactly what we do every single day. And really knowing that we need to teach the public more that they can tap into us as resources and that they can trust us. And we're there to help guide them in making their best decisions about their healthcare.
All right, Jasmine, I'm going to ask you to turn your video off and mute your microphone here, and Bethany will launch the poll. We'll launch that poll for approximately 45 seconds. We do have one more presentation that will be from Beacon Biomedical that's coming up in just a few seconds here. Again, great questions have been presented by the judges, and if you're watching, you can use that Q&A feature at the bottom of your screen to submit your own questions. If we do have time, we will try to get those questions to our finalist companies. Again, we are going through the poll here, and we have one more presentation before we will dismiss the judges for deliberation. That will be a few moments, and then we'll bring them back in to conclude the webinar today. Okay, our final presentation will be from Donald Weber. He is the CEO of Beacon Biomedical. So Donald, take it away.
Great. Thank you. Before we get started, I'd like to thank GPEC, the judges, and all the virtual viewers, as well as the presenters, for allowing us to make these presentations today and for your support and participation. So next slide. So who is Beacon? Beacon, we're a CLIA accredited laboratory that has successfully introduced our first product into the marketplace for colorectal cancer screening called B-Screen CRC. We're partnering with distribution partners like SnoreQuest and NA Test Now to help us with our sales and marketing. We're already an in-network provider for United Healthcare. We have 2 corporate health and wellness clients already using our test. The first of this year, we were able to secure our own reimbursement code for B-Screen. Very excited, from the American Medical Association. And prior to the COVID crisis, we were initiating partnering discussions with Care2You mobile clinics for introducing our test to the marketplace at the point of care. Next slide. Well, our test is considered a discretionary test. And so with COVID and social distancing and the stay-at-home orders, it basically has brought our testing to a halt. And it's also negatively has impacted our investors' appetite, waiting to see where this economy is going. So the challenge for us is maintaining our mission to saving lives through earlier detection of disease states, but at the same time, how do we refocus our energies and our resources to actually have a positive impact on reducing some of the anxiety associated with the COVID and getting our lives back in order. Next slide. So to understand this, we really have to understand who's at risk. It's amazing, these numbers. There's 80% of the deaths here in Arizona are individuals over 65 years of age, 90% in Maricopa County, and over 50% of those come from the nursing homes and assisted living, the most vulnerable. Next. The other part of understanding the equation is what's the demand for tests. There's over 100,000 tests each month. That we do not have the capacity in Arizona to meet that demand, and that's exacerbated by these stay-at-home orders, keeping access very limited to testing. So it's time to pivot. Next. Well, with Care2You, we were discussing how we bring our tests to the marketplace. Well, they're already in the marketplace with on-site sample collection, cancer screening, consultation, health management. They have existing contracts and are a preferred provider for over 200,000 patient lives in the individuals who are over 65 years of age, the skilled nursing, adult retirement community, senior care and advocacy groups. They're also a contractor for COVID testing right now in terms of the sample collection. And to date, have done over 3,000 samples since April. Next. So we are partnering with Care2You. We're putting them under our CLIA umbrella. But now we'll be able to bring the testing to you, the right test, the right place, at the right time to the right individuals. Because what good is a test that's 2 to 3, maybe 2 weeks out to find out you're COVID positive? You've lost the initiative and the advantage. So that's the importance of bringing the test to you. And that's what makes us so unique. Next. We're going to accomplish that by using Vodetech Med's APHIS system, which is a fluorescence immunoassay that allows us to test either finger pricks, serum, plasma, eventually saliva, at 94% accuracy to detect the antibodies as well as the virus and get those results in just 10 minutes. We'll be loading these systems into the mobile facilities and have support within our traditional lab to move this out to the marketplace and meet that market need. Next. With the contracts already in place, we're already addressing the most vulnerable. So we're already there in those communities. And once we get servicing them, we'll translate that and move that down to the other higher risk communities, to the colleges and universities to help get the students and faculty back to work, get the employees back to work, and then the urgent care centers where it will also be needed. Next. The next 180 days, we see the revenue potential at 14.2 million and the addressable market at 11. Now, while that may sound high, that's only 500 tests a day. You can complete that with 3 of the APHIS units. And so we'll be expanding that. So the key is how do we scale for this? Next slide. We'll be doing that by adding units over the next 90 to 120 days, both in our laboratory here at Beacon, as well as ramping up into the mobile laboratories and supporting that with additional staff and logistics and reporting capabilities. We plan on putting a fleet of these laboratories into the field to get real-time results and actual demonstratable results so we can take action on those. Next. So we look at the funds from this grant as being an awesome start kick for this project. We'll be able to put 2 units out in the field immediately in the next 2 weeks. And then we're also going to complement that by going to the community, the investors, and seeking another $300,000 to $500,000 to accelerate our ramp up. Next slide. Well, this can only be accomplished by making sure you have the right group behind it. This group here represents over 120 years of combined lab experience, assay development, diagnostic testing, immunology, corporate business development, marketing, sales, as well as regulatory and government affairs relationships that we built. We're a team of seasoned veterans. We've been there, we've done that, and we're doing this again by refocusing our efforts and resources and our existing relationships to focusing on getting COVID testing, as I said earlier, to the right people, right place, right time, so we can take immediate action. And that will have an impactful, very impactful, positive way of pushing back this COVID paralysis and to help getting all of our collective lives and economy back on track. So I want to thank you once again. Appreciate the time. I look forward to answering your questions.
All right, Donald, thank you so much. Let's bring our judges back in and open up the floor for questions.
Super quick question, Donald. Thank you for your presentation and for your pivot here to address COVID-19, which obviously is incredibly important. Can you just confirm that you're saying that the mobile testing is going to be to test for viruses as well as antibodies and not just antibodies?
Yes, that's a great question. We're doing antibodies initially. We are networking out our COVID virus over the next several weeks. We already have that group in place, but we are bringing the virus to that system. The testing being done now, they're submitting it to FDA for the EUA, and we'll be able to do that on site.
Great, thank you.
Yeah, I like your target that you're hitting the most vulnerable. Are these APHIS units the same? Are these the South Korean units?
Yes, yes. Fred, that's actually a great question. They are in South Korea. They're by, I got to remember the manufacturer, Bodotech. I'm sorry, lost it there. Bodotech Med. They are out of South Korea, and we can actually expand that into the flu season by doing influenza on the same piece of equipment.
Hey, thanks, Don. Can you talk through some of the logistical challenges? I'm assuming you can't just pull one of these rigs up to any parking lot anywhere. What type of partnerships, municipalities, businesses, whatever, what is the thought put there?
Yeah, it's what we do is we schedule in advance, Brandon. The units are set up in advance. We come and visit those facilities. We're already visiting with Care to You. They've already had those logistics figured out. So they go and visit these communities, let's say a retirement community. They'll set up a time where they come in, meet at either the golf course area, set up the facilities, and have people come to them. The nursing home facilities are different, right? So we'll pull up. We can actually move inside to grab the samples, take them back to the lab. I think that's the best part of the teaming with Care to You is that they've been at this since 2013. So they've worked out all those little idiosyncrasies to make sure that they got those, the planning, the processing all in place.
All right, Donald, thank you so much for that. I am going to ask you, just like I have done with the other companies, to turn off your video and mute your microphone. We are going to open up the polling here. And in just a few moments, I am going to dismiss the judges. And then we will bring the judges back. Okay, judges, I will ask you to turn off your video and mute, but do not disconnect because we will be bringing you back in here in just a few moments to go over what your deliberations were like. And now I'm going to ask the companies to jump back on. Please turn your video on. Please turn your microphones on because we do have some audience Q&A that we'd like to get to before bringing the judges back in. Okay, we have a question coming in for Televeda. How many facilities are you currently in?
Great question. We are in we have over 16 clients across North America. Keep in mind, we not only service senior living communities, we also service other organizations that serve seniors or other vulnerable populations. So prime examples are we service the entire city of Chandler. We have established their first virtual recreation center across North America. We also service Special Olympics of Arizona. We service the homeless population and the donor base for St. Vincent de Paul. So we are seeing new verticals after COVID-19, and primarily it's because there are other populations that also suffer from social isolation and loneliness. So through our service, we're able to cater to not just seniors who are, affected by this unfortunate situation, but really other demographics that are also figuring out how to stay connected.
All right, Trudy, thank you so much. Let's bring in Daryl. I think we have a question for Sensagrate. Yes, will Sensacat be used for private companies only, and what kind of equipment would be needed?
No, it could be, the purpose could be for any kind of business. And our goal is to provide a full out-of-the-box solution. But if you want to do integrations into like a badge access system or turnstiles, we're also partnering with like electrical engineering companies or security companies to help integrate into businesses.
All right, thank you, Daryl. And again, thank you for the audience for submitting these questions. Navi nurses, we have a question coming in for you. Is the software already built into an app and in the stores? If the 50 is used for customer acquisition and PPE, does that mean the nurses and the app are already done?
Thank you for that question. So the app is actually something we are doing manually for right now. We're doing the matching. However, the software that we have in place is tremendous. It uses telemonitoring, so we can actually look at patients with chronic conditions and keep track of how they're trending with things like heart failure and diabetes. And it also has an EMR that's part of this and allows for families to be involved. So that platform is already built. And really when we made this pivot, it was because we don't have the time to be able to build something from scratch. We wanted something that is already existing, proven to work. People have incredible success with it. Patients and providers use it and enjoy it alike. So this is really going to help us develop the pivot portion. And then down the road, we'll be able to actually fund the actual app itself.
Got it. Thank you, Jasmine. All right, Beacon Biomedical question coming in. Where do you see deploying your mobile test vehicles? This viewer is particularly interested in how you see serving the disadvantaged, most at-risk populations in our community.
That's a great question. When we look at, let's take example of the tribal communities. They represent 4% of the population in Arizona, but 16% of the deaths. So we're already communicating with the tribal industries about pulling the tribal communities, pulling the vehicles up to their social centers, being able to have them come to them under either a time frame where they set up schedules in advance, so appointments. We'll also be looking at working with Access to make sure that when we work through the clinics, because really the key to all of this is access, not the access Medicaid, but access to the testing. And so the idea of being able to bring those to the clinics where they go to, like the Next Care clinics, wherever they can go to get their health care, bringing those facilities up to where they can actually be tested on site.
Donald, thank you for that. And I have a question here that I'm going to offer up to all of our panelists. I think, you know, for those of us who watched last week's, one of the themes was sometimes the investment is about the entrepreneur. And the question that just came in is, you know, COVID is going to be here. We don't know, it could be here for a long time. So I guess, what have you learned about yourselves during this process, and are you prepared for the long haul here? And Donald, I'll start with you, and then I'll offer this question up for the remaining panelists.
Yeah, I think what we learned is without having real great guidance off the very beginning and data to work with, there's a lot of anxiety out there in the marketplace. There's a lot of anxiety in our own personal lives. I think one thing I've learned to appreciate is that you know, knowledge is power. If we have more knowledge of what we're dealing with, and how to deal with it, we can do a better job of managing not only our personal health care, but our community's health care as well. And for me personally, I think because we're in the lab business, I think the idea for us is, you know, how can we actually provide that data, that knowledge, so that you know where you are and then where you can navigate next, because it's the unknown that causes the anxiety. And data provides us with known pieces of information that we can make better decisions with. So
thanks. And Jasmine, I'll ask you the same question on the personal level. You know, what have you learned throughout this process, and, you know, are you prepared for the long haul?
You know, I think that's a great question. We have to be prepared for the long haul. This isn't something that's going to go away right away. And I think what we've really learned is there are holes in healthcare, there are gaps. We're not meeting the current needs of our patients, and nurses are in the prime position to really help reimagine healthcare. And what does healthcare look like post-COVID, and how can we be a part of that to really make consumer-driven healthcare a reality? And that's what we're hoping to do.
Thanks. Daryl, same thing, you know, just you personally going through this process. What have you learned about yourself, and, you know, through this pivot, what are you prepared for?
We have to be flexible and really scrappy, talking to multiple people from different businesses to make sure we're targeting the right market and seeing who's interested and who's ready to apply it into their businesses, especially essential and critical manufacturing companies. And then I would also say that we're definitely in for the long haul, because we know that COVID-19 is not going to be the last pandemic that we face as a society across the world. And businesses see that this application can also help them detect flus and other viruses that they're dealing with that create an economic loss in their business.
Daryl, thank you. And Trudy, you started our presentations, and I'll let you close with some final remarks here. Just again, sort of that same tone of what you've learned about yourself as an entrepreneur during the COVID pandemic, and then what you're preparing for the long haul here.
Yeah, I think for me personally, my mission for eliminating social isolation has become a lot stronger, and that has also resonated with us as a team. COVID has just helped us accelerate the growth for us as a team to really tackle this problem. I think, but COVID is not the only problem that is going to get thrown at us, and there are going to be other obstacles that come through. And as a company, we've pivoted already, and we are all, you know, we're very prepared to pivot with whatever issues come thrown at us. I think just as a team, this has just made us realize that come COVID, come whatever, we're a resilient team, and we're really out there to solve the problem of social isolation for anybody and everybody.
Shruti, thank you so much. And it is time for our final poll. Bethany is going to launch that poll. We're just a few moments away from welcoming the judges back into today's webinar. So this is the final chance for the audience to weigh in here. And then we will bring our judges back in to make their decision. Again, want to thank all of the audience for joining us today. Very exciting regional report. Hang on, I'm getting some notes here from Bethany. Yep, so the judges are continuing their deliberations. I know this has been a very exciting day for all of the companies joining. And Jasmine, since we have you back on screen, we didn't get to hear from Ian here on your thoughts personally as an entrepreneur, as a founder, what you've learned about yourself through this process as a leader, something that we can all take away from this.
You know, Jasmine and I, we both work on the front line. We've been caring for these patients and these family members that are going through this, and you know, as nurses, we're resilient, and we've really learned how to think bigger because we want to impact more people, and Navi really is the answer to that and how we're going to be able to do this.
Well, again, thank you to all of our companies joining us today. We are ready to welcome the judges back on. They will be turning their video on. And speaking on behalf of the judges will be Fred Pakis, again, the Pakis Center for Business Philanthropy at the Arizona Community Foundation. So Fred, I know you've spent some time talking with the other judges, and I will turn the floor over to you.
Yeah, thank you very much, Eric. And thank you all presenters, all very much. It was a very difficult decision. I appreciate the difficulties that you're facing as small businesses in these very tough times. But you got our attention. We listened to you all. And our unanimous decision is to go with Televeda.
Thank you. I appreciate that. Thank you so much.
Rudy, congratulations. Just tell us what you're feeling right now.
I have so much gratitude for this community here. Thank you really very, very much. You have no idea how far this grant is going to go for us, and I mean it from the bottom of my heart. We are, I'll tell you a quick story here, and hopefully, you know, you understand the kind of emotions we deal with every day. We have one of our participants, and I'll call him Glenn for privacy reasons, but we have, every day we do 3 classes, and we run classes 5 days a week. Glenn attends every single class, and he participates in every activity, not because he likes to do chair yoga, play brain games, but so that he can meet everybody else who is part of that community. And he comes every time and shares the stories and talks about how he's dealing with his everyday. He takes care of his 90-year-old mother. And this is his way of communicating and being connected with the community. So your grant is going to help so many Glens out there, not just in Arizona, but in like all across the country and in North America. So I really, really appreciate you believing in our cause and our mission. And I think together as a community, we can impact so many lives. So thank you so much.
And Shruti, it's great to see that passion and emotion because that's what this is all about. Jimmy, I understand you want to make a quick statement here?
Yeah, just a quick, you know, Shruti, I know you're connected to a lot of resources around the community, but we wanted to encourage you to connect even further, whether it's through StartupAZ Foundation, StartupAZ Collective, really looking at even some other options. You know, we've got some great startups here in the Valley, including ones that do remote, all the customer service stuff. You know, Botco.ai is a company that came to mind immediately. So we wanted to, in addition to this grant, offer you any help to help maximize your next steps and really think about, you know, how to take this money the farthest that it can go, because there is this great startup community all around you here. So congratulations again, and that's our encouragement to you.
Thank you, I appreciate it very much. I will reach out to you separately if that's okay with you.
So congratulations to Shruti, and again, thank you to all of our finalists today.